friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also give your valuable comments. Okay, so as we know, we are already discussing about the samskaras, basic part of the samskaras, and so many samskaras already we have completed. And today we will have another important samskara which is mentioned in our science. So that is called as Nishkramana science, Samskara. So procedure of Nishkramana Samskara. Now what is this Samskara? Let us see the details. Chaturte Sutikagara Agni Skanda Progamahan Mase Nishkramayet Vahan Namaskartuhu Swalankratan. This is the reference given in Ashtanga Sagraha, rather Ashtanga Hridaya. Uttar Tantra, first chapter, 40th shloka. Similarly, Kashyapa Samhita gives the detailed explanation of Nishkramana Samskara. Kashyapa says, Chaturte Masi, Snataha, Alankrityaha, then Samvitasyaha. So like this, Devatagara Praveshagamanam. So like this, he gives the details of Nishkramana Samskara. Similarly, Tatra Agnim Prajulanaham Gritaha Kshatera Bhyarjaha Brahmanaham Ishwaram Vishnum Skandham Matraschanyanicha Kuladevatanihi Gandha Pushpaha Dupa Malyopahari Baksheshcha Bahuvidir Sampuja Tatoho Brahmana Vachanam Kratvaha Teshamashishoho Grihitvam Avivadyacha Gurun Punaha Swamagaram Pravishayat. So these are the references given by Kashyapa regarding Nishkramana Samskara. We will see the details later. Pravishtam chenam anenaha mantrena abhyuktaha bishagvartetaha sharachataham jivashishoho tvam devata abhirakshataha dvijay rapya ashishaha puto gurubhisha vinunditaha. So this is the reference of Nishkramana Samskara which is given in Kashyapa Kilastana 12th chapter 4th and 5th shloka. Now come to the details of this Nishkramana Samskara. What do you mean by Nishkramana Samskara? The meaning of Nishkramana is taking the baby outside the home for the first time. Okay, so this procedure is advised during the infantile period of the child. Okay, then where the baby is carried out of the home for the first time after the delivery, and usually it is for a temple. Okay, so procedure is very simple. This procedure is carried in the 4th month of the life. Yes, it is conducted during the 4th month, the beginning of the 4th month of the life. And what we are doing here is, we are taking the baby outside the home for the first time. And usually, for the first time, it is taken to the temple. And this has got its own significance in the examination of certain developmental milestones. By doing this samskara, we are able to do the examination of certain developmental milestones. Of course, nowadays this is observed with more religious importance than the scientific understanding. Of course, if you go to the village area and other areas, in traditional families, they do this Nishkramana Samskara, but again, they don't know the scientific importance. They will do it with the traditional importance. As a ritual, it is maintained. It's conducted. Ayurveda classics like Kashyapa Samhita and also Vagbhata, as we have seen the shlokas, they explain this procedure in detail. Okay. Apart from this, Hindu religious books like Manusmriti and Dharma Sindhusara, that also explains about this particular procedure. What is the procedure? Procedure is very simple. Procedure is taking the baby outside the home for the first time and usually to a temple, as mentioned in Kashyapa Samhita. Now, in the 4th month or the 4th month onwards, the baby can be taken out of the house by following specific methods. So during the Nishkramana Samskara, they mentioned certain specific methods. Okay, so baby should be given bath, then on wearing a clean sterile cloth, gets decorated, and after worshipping the god, Brahmins and elderly person, being accompanied by Agni and Skanda, they should be taken out of the home. This is, I am explaining the procedure. Mother or the Datri who is carrying the baby should be cleaned by taking the bath and then on wearing the clean clothes should have taken the Madhu, Grita and Gorocha. First time the baby should be taken out of the home, usually for a temple, nearby. So these are the prerequisites. Okay, before going outside, mother should be also clean and baby should be also clean. They have to wear the clean cloth, and also they have to take, both of them have to take the certain antiseptic measures, okay, or disinfectant measures, so that there will not be any infection or cross infection. Now in the temple, now here the temple has been taken as an example. You can take you can take the baby anywhere, okay, outside, but usually it is always better to take a temple, and therefore the Kashyap has given temple as an example that we will see. In the temple, child is made to see the god and bows the head, and meanwhile it look at the unknown persons and get exposed to new environments. Okay, so far baby was there in the home only. Okay, so during the Suryodaya Darshana Samskara, baby was there in the home. Afterwards, for the next 3 months, baby will be there in the home and courtyard of the home. That's all. Okay, so more than that, baby is not yet exposed. Now, for the first time in the 4th month, baby was taken outside the home and outside the courtyard of the home. So therefore, a little precautionary method like antiseptic measures should be taken. Now, when it is exposed there, come to the temple, for example. So now it is exposed to new environment, and so many people will be there. So different types of worships, oblations should be performed by uttering the name of the child. Okay, so child will be shown to the teachers. In the temple we have teachers. In the temple we have the Brahmins, and child is shown to the Brahmins, sages, gurus, etc. And they will receive and they will give the blessing for the bright future of the baby. The child is receiving the blessings from these elderly and learned people. Later the child will be taken back to home. While physician chants the mantras for its welfare. So this is what so far explained is simply the the procedure which is mentioned in the classics. Now let us look at the importance of this particular Nishkramana Samskara. So far we have seen the traditional methods and rituals. Now we shall see what is the utility of this Nishkramana Samskara in assessment of the growth and development of the child. Now, again, this is one of the best methods explained in Ayurveda for the slow exposure of the baby to the external world. So we know that from the 8th month of pregnancy till the completion of Sutika Kala, baby was there in the Sutika Gara. Then for the first 45 days after the birth, the baby was there in the home environment. And then from the 1 month onwards, so baby will slowly get exposed to the courtyard and sun exposure, etc. Now after the 4th month, for the first time, baby was now taken outside the home to another area. Okay, so like temple, etc. So what this explains the slow exposure of the baby to the external environment, which is very, very important. Now, till the completion of the 4th month, baby is susceptible to various infections as the immune system is functionally immature in case of baby. So it is risky to expose a child prior to that to the external world. Once the baby is stabilized completely, by all means, okay. So feeding habits, bowel habits, weight gain pattern attains the steady rate, and the baby start thriving well by this time. And this time you can take some risk and expose the baby to the external environment. Baby when taken outside usually get exposed to strong rays of the sun also. That is also true. Okay, because now baby is able to tolerate the strong rays of the sun. Okay, again this is also a type of exposure now to the baby. In the last Suryodaya Darshana Samskara, we have explained the role of sunlight in prevention of the rickets, etc. disorders. So, hence the disappearance of the physiological photophobia and also complete development of the apparatus of the eye and vision are the important criteria for the external exposure which will be attained by this time. In the 4th month, if you see physiological photophobia disappears, okay, child is able to tolerate the sharp rays of the sun, child is now fit enough to face some of the infections, like immune system is very strong. So these are some of the criteria that you have to follow before exposure of any baby to the external environment, like taking away from the home, okay, to the other cities, etc. Now, Kashyapa clearly mentioned that child should be taken to a temple. Okay, of course, the temple has been taken as an example here. Okay, you can take the baby nearby temple or any other areas or some other praying areas, etc. Okay, so temple has been taken as an example. It helps to assess the development of milestones in the fourth month of the age. Suppose if you taking the baby to a temple, and the environment in the temple, it also helps to assess the, because physician is always accompanied here. Okay, it's told in the procedure. Physician is always accompanied, and he is chanting the mantras. So when it's taken to the temple, it helps to understand some of the developmental milestones. Okay, now in the temple we have got red and different color of the flags. Okay, so identification of these flags, child is looking at it and enjoying it. So this helps for the color vision and accommodation reflex, examination of the color vision and accommodation reflex. Now ringing of the bells, which is present in the temple, and also chanting of the mantras. So this help us to see the response to the sounds. Okay, response to the sounds. Now if the child is not at all showing any importance or towards the bells, response to the sound of the bells or mantras, and not at all looking at the site of production of this sound, this may be earliest pickup for the autism like symptoms or deaf mutism or deafness, etc. Okay, so looking at the god, so this is fourth month. Now in the fourth month, head control is completely developed. In the third month we have got neck stability, neck control will be there. So head control is completely developed now. Okay, so looking at the god, whether the child is able to look at the god, lift the head. So this is a test for the head control of the baby. Then bowing of the head to the gurus. Again, a range of movement of the neck can be examined by that. Many unknown people will be there. This is very important. There are many unknown people. Now look at the response of the baby to the unknown people. Okay, so stranger. Okay, what is the response of the baby towards the stranger? So that can be also examined. Another important is when you take the baby to the temple, on the way you have got so much of trees, plants and greeneries, etc., birds, etc. Okay, so look at the attitude of the baby, whether baby is looking at these scenes very cautiously or curiously, because this is considered as age where baby try to explore the world. Everything is new for the baby, so it try to explore it. So look at the response of the baby, whether the baby is enjoying the greeneries, whether the baby is enjoying the sounds of the birds, etc. Suppose if the baby is not showing such a response, then itself is one of the sign that baby is not growing well as far as growth and development is concerned. Now, Kashyapa clearly mentioned that child should be taken to a temple. Following factors, and this we have seen. Now, one more very important thing is a social smell. Social smell is completely developed by this age. Okay, because social smell development may start from 2 months of age. By the end of fourth month, it is completely get developed. Okay, social smell is a smell which baby gives to the mother. Okay, understand the words of the mother or give the response to words of the mother and look at her and give a smile whenever she talk to baby. Okay, this is called a social smell. Okay, this is called a social smell. Social smell is completely developed by this age, and response of the child to the unknown person, like laughing, crying, and fearing, should be observed. Now, when you take the baby to the temple, look at the response of the baby to the unknown people. By looking at unknown person, baby may have sometime crying, baby may sometime frightened, or baby may sometime laugh, simply laugh, and sometime baby may start crying, or sometime baby may hold back the mother. Okay, it may hold back the mother tightly. Okay, so now suppose no response of any kind has been given. Somebody is coming and talking to the baby and laughing with the baby, but baby is totally expressionless, not giving any of the present response. Then itself is a bad sign. Okay, so next, head control is completely developed by this age, and child can move the neck 180 degree very comfortably, and it shows the response to the peculiar sound by this age. So that should be also observed. Child in this stage is eagerly watches the proceedings with a curious and fearful look. Okay, under the safe shelter of the mother. Now this observation has to be also done. Absence of such behavior with a dull look itself indicates that child may have delayed development. And now these are some of the important points that we can understand by means of Nishkramana Samskara in the present day context. Especially some of the few things are important. Social smile is important. Then separation anxiety. Separation anxiety is also important. Suppose somebody is picking the baby. Okay. Baby is there in the safe shoulder of the mother, but some of the other people are coming, and person is coming and asking the baby to come. But now baby's response is very important. Baby may go, baby may not go, baby may start crying, baby may look at with the frightened eyes. So this response is quite normal for a baby at the 4 month of age. Suppose the baby is not at all giving any response, and then it's not so good sign. Then social smile. Development of the social smile by this time should be perfect. If it is not there, that suggests that social developmental milestones are delayed. So we can assess very early. And baby is not able to lift the head. Suppose hydrocephalus like conditions. Any conditions with the increased intracranial pressure, baby is not able to lift the head by this time. Baby should have able to lift the head at control, keep it the head in straight, and able to move the head in all the 4 directions. Now this is very, very important. This particular samskara is not simply a ritual or of traditional importance. So when it's done properly, this helps to identify all these developmental milestones. So Nishkramana Samskara is one of the best samskara to identify early developmental milestones of the baby, especially at the up to 4 months of age. So if everything is fine up to 4 months of age, that means that Nishkramana Samskara is normal. Okay, so these are some of the intentions, aims and objectives of this Nishkramana Samskara. Okay, so however, nowadays we are not practicing with such a scientific importance, because if you have lost that scientific importance, nobody knows the scientific importance, and everybody is following this as a ritual, which is quite unfortunate. But this is one of the classical method of Ayurveda to assess the growth and development of the child. So with this we conclude today. We will meet in the next class. Don't forget to subscribe my channel and also give your valuable comments. Thank you very much.